Welcome to Mountain Valley today. We're certainly glad you've tuned in. And today I've got Dr. Chad Williamson. Chad, welcome today.
Thank you, David. Glad to be here.
Well, we're going to be talking with Dr. Williamson. I just saw you, Chad. Do you like the doctor?
Yeah.
I mean,
you can do whatever's more comfortable.
I mean, you've
Dr.
spent
Chad, definitely
Dr.
not
Chad?
Dr. Williamson or Chad, either one.
That's a lot of money, a lot of time, a lot of investment on that. So,
It has been a long journey, and I'm glad to be back home.
well, we're glad to have you back. So let's talk about you, I guess. Where'd you grow up? I think you went to Sylvania. Is that correct?
I'm a Sylvania grad. I graduated in 2004. Did a year at Northeast, then on to UAB, and for there I was there probably 7-8 years for med school and undergrad. So a long time in Birmingham.
Well, a lot of dollars, I'm sure.
Yes.
UAB.
Yes.
But we're glad that we're glad you came back to DeKalb County, and you've got an office in Fort Payne.
Yep, we're at 617 Galt Avenue North, the old Charter Cable Building.
Okay. And it's called
DeKalb MD.
DeKalb MD. And so we want you to come and visit Chad. I'm sure you're welcoming all new patients.
Yes,
You're building up that clientele.
that's true.
So is there anything you specialize in, or just general practitioner? Is that what you call it?
So now it's called family medicine, but it's
Okay.
basically a general medicine. We take care from birth all the way to the grave.
So you just jumped in the boat, opened your own practice. I bet that was a little scary, was it?
Yeah, nobody really does that anymore besides the few we have around here. Probably some of the last ones actually open up their own practice. And yeah, I had a vision to do things a little different, and opening up my own practice was the only way to do that.
Well, we're certainly glad that you've come back. I was a Sylvania grad back in 1980.
I did not know that.
Yes, I grew up in Henniger, Alabama. Transferred to Sylvania, went to high school there. Most people think I am from Plain because I live in Rainsville.
Yeah.
I'm just old as dirt. That's the difference. But why did you decide medicine was the thing for you? What led you down that path?
I think just because my upbringing, my parents were pastors of a church, always in the giving kind of industry, and I found myself enjoying math, science, being around people. Did some shadowing in the local hospital ER and with Dr. Sims, and really thought this is where my calling is.
Okay.
And just went down the road, and here I am.
Well, what advice would you tell a young person that might be thinking that the medical profession is something for them?
Yeah, there's definitely a need. It's one of the professions that you're always learning, always. You're never going to know everything, so it's one of the fields where if you're driven to continue learning, it's where you need to be. And don't give up. If I can do it, you can do it. I wasn't definitely not a standout at Sylvania or UAB, but with time and dedication, I think anything's possible.
Well, I'm sure maybe you might help us as we get some kids that might be interested working in the healthcare field, maybe to come and job shadow, do some clinicals there. I'm sure they would love that opportunity.
Yeah, we're always welcoming students. We actually have a nursing student with us right now, and she's learning. We've had some high school students come by and take a look. We're always more than welcome to sit down and come to the schools and talk to them and let them know what they can expect and if it's right for them. But definitely shadow before you go down that road.
Well, people just see when they look for jobs, they're looking for the glory part of it. They don't see the in the trenches kind of deal. I mean, I hear that when you do your residency, is that like forever and a day long?
Yeah, it's wake up at 5 and get home at 6 or 7 p.m. every day. You get 2 or 3 days off a month.
Month.
It's a grind.
Did y'all hear that? A month. It's not a week.
It's a grind. It's probably one of the lowest times in my life. I was definitely tired. I was newly married, and I was worn out.
Well, let's talk about that. You've got a family now, so let's talk about how you all in love and the family and that kind of thing.
So I'm married local, Ashley Seibert, now Williamson. She's from Fife. We have a son who's 19 months old, Hayes Williamson, and he's definitely the enjoyment of our life and keeps us entertained.
Kids will do that.
Yes.
I'm telling you, you really took the plunge. You graduated and you've opened your own business. You're married. You got a young son. So, I mean, if there's like first, you've just like click.
We did. We always have to have something going on.
Well, that's probably because you were in this bubble of school for so long, do you
Yeah.
think?
Yeah, because now you have some time. You're like, I should be doing something. You're not used to actual time away from studying and practicing. So
Well, and I'm sure, I've never asked my doctor this, but I know he's always talking about stuff he's read in a journal or something. There's always continuing ed and
Yes.
latest stuff that comes out. So that's one thing that I think people who decide to go into a profession, whatever it may be, there's always room for professional development, stuff you've got to keep going. So tell me what that's like. How long have you been out of residency?
residency 6 months. 7 months. We started our practice 6 months ago.
Okay.
2 days ago.
Wow. Seems like it's flown by, right?
It has flown by. I cannot believe we've grown as fast as we have, and the community's very been receptive to us, and we're continue doing it as long as they let us.
Well, I know also that you're giving back to the community. Why don't you tell them a little bit about, I've seen you on the sidelines. Let's
Yeah.
talk about that.
Yeah, so still go to Sylvania football games, basketball games. Just try to, be there for the students as well. Just show them, that they do have people that care for them, as well as, anything that I can do as a doctor. I'm there for them, and we have a lot of football players and baseball players that come down to our clinic. We take care of them, and on the sidelines, it's just fun to still be around that
Atmosphere.
Yeah, so I enjoy it.
Well, I was there taking pictures one night, and I saw you on the sideline. I was like, oh my gosh, I would feel so much better as a parent knowing my child was playing football and there's a doctor on the sideline.
Yeah, they do. They treat me well. They come up and tell me how much they appreciate me, and it means a lot to me to come back and give back to them.
Well, what kind of advice would you give just the regular person? I mean, I've always heard that men were the worst about going to a doctor. You just try to suffer through it or whatever. You don't want to talk about it. But what kind of advice would you give just the regular person about their health care?
Yeah, well, definitely guys are more stubborn, more set in their ways, and they have to be really bad before they come to a doctor. But we have a different atmosphere at our clinic. It's a lot more home environment. Once they see us, a lot of times they just call me, text me, my patients, email me now. So they don't have to come in for every little thing. And they like that they'd rather take care of the phone. They're busier. They don't want to leave work. So that's good. But for everyday health care, we kind of sit them down, just kind of shoot them straight. You guys are either going to have to start taking care of yourself or you can take care of other people. So we encourage the gym. We encourage better eating. We don't really set them, down and say this is what you got to eat, but we say this is some of the things you need to start eating more of, eat less of these things.
Leave off some of the bacon?
A couple pieces of bacon a day is fine. It's that bread and biscuit that we tell them that they better watch out of. But yeah, it's all about moderations, and we encourage 3-4 eggs a day, a couple pieces of bacon, you'll do fine.
Really, people who skip breakfast really should think about eating a good breakfast. That just gets you started for the day, makes your day so much better.
Yeah, and your stress level's a lot better if you can, have a continuous meal throughout the day. We encourage, smaller meals, but when your blood sugar starts going up and down, your same stress hormones are released. So even on a mental standpoint, you're better off to have that breakfast.
Yeah. Well, and just moving, just not just being a couch potato. Getting out and walking, doing something would be, I'm sure, very beneficial.
Oh, yeah. Right now it's a little colder outside, but there's definitely walking tracks at gyms and treadmills. So I tell people, even if you can only get there 5 minutes a day, get in there. And, if you do more, that's even better. So.
Well, I know that. What are your hours down there at Fort Payne, and how can they know when they can come make an appointment or come to see you, or maybe transfer their what am I looking for?
So our clinic is definitely set up different. We wanted to go back to the old school where doctors work for their patients, not for insurance companies, not for the government. So we have a direct contract with every member. It's month to month. They pay us a monthly membership. We don't file any insurance. We give them 24/7 access to their doctor. They can call me, text me, email me, any time of the day. They're going to get hour-long visits. They need it. They're going to get no waiting room. They're going to be seen at their appointment time. So people like convenience. We give them wholesale labs, wholesale meds. Saves money there. And we have a 24/7 hour fitness center. So we're all about the exercise.
Well, that is really unique. I've never heard it put that way. Now, what if someone has insurance but they would file it themselves? Is that how that works?
So we encourage, they can file it themselves, but we encourage people to try and go out and find a catastrophic plan. Those plans used to be a lot more than they are now, but you can still go. I've checked out United Healthcare. They still have plans that are just for catastrophic, where you use only if you go to ER, hospital, specialist, something like that. And then you pay us the monthly fee, and we take care of everything, which usually gets you better service. It's just like your auto insurance. Do you use your auto insurance to pay for gas, change oil? No, because if you did, it would be expensive like our health insurance. So yeah, we go to these businesses and we say, look, start pushing them towards more consumer-based plans. The HSA, you put, say $5,000 on the HSA for that employee. That employee has responsibility for that. If he doesn't use that $5,000, it rolls over to next year until retirement.
Okay.
But that employee is also better at using that $5,000 than paying that insurance company and maybe never using it. So
that is a really unique opportunity. I've never heard that before.
Yeah. It's actually started kind of out west. When you ask doctors these days, they're not really happy with what they're doing. Patients are not happy with the service they're getting. So we're trying to get back to working directly for those patients. And I think people are really catching on. They're saving money, but they're also getting better service in return.
So if someone's interested in going down this route, not paying a monthly premium to an insurance company and having to fight with them and all that kind of stuff, would you sit down? Is there someone who can sit down with them and explain the process? Because it's so foreign. I don't want to say foreign in a bad way. It's different from what most of us are accustomed to.
But actually, when you hear it, it actually makes sense. It's like a direct way. You cut out the middleman. You just use insurance for catastrophic stuff. But yeah, we do free consultations. We will sit down and help you. Megan Guffey is actually a Plainview grad.
Yes.
She's actually one of our patient care directors, and she'll sit down with you as well as me, and we'll find you kind of the best plan. We use a lot of cost-sharing insurances like MediShare,
I've heard about
like
that.
Liberty Direct. These are better rates, but they actually do the same thing as Blue Cross. They'll pay that. They actually pay better than Blue Cross and Medicare in a lot of these places to the hospital, but they don't put up the same headache that a lot of people have to deal with. So we use a lot of those. Like I said, we'll get online and go to a Cigna, go to somewhere else. Even Blue Cross has some plans, but really it's just all about shopping around.
Well, I never even thought about that.
Yeah.
I've heard about MediShare. I've heard it on the radio a time or two, and how that customers who are part of that program will get a letter saying that someone shared the bill, shared this.
Yeah.
And I thought that was, I guess the Christian radio station that I listen to is promoting that a lot.
Yeah.
But do you find, let me see if I can put it this way. Growing up in the South around this place, when we grew up, the type of music we listened to at church was like traditional.
Right.
Well, now we have praise and worship, and some of us went to praise and worship kicking and screaming. So you're going to have to help people understand this is a whole different type of insurance. So you're going to have to help them understand it's not the same as it's always been.
Exactly. But it's actually, before we went to this, you used to pay your doctor with, eggs and bacon. Now it's going back to the same thing. We charge a monthly fee. That's so we can do the preventive stuff. That's so we can spend time with you. The current system, you have to wait to see your doctor a week sometimes. And then when you do get in there, you're waiting in the lobby for a couple hours. And then you're getting 10 minutes with the doctor because he has to go spend 10 minutes or 20 minutes on a note that has nothing related to what you do, but just to get paid. And it's just a cycle that it should be A to B, but yet it goes around. We tell people we don't care if you have insurance or don't have insurance. You can still come see us. Half our patients have insurance. They would just rather deal with us than their insurance or doing through the system. So that's a big thing is people just want a doctor that listens to them, that has the time for them. We limited our membership to 600 to 1,000 per provider. We'll bring in another provider, more locations, but really that's so we can get you in that day if you have an acute visit. That's so we can reply to your text message. When you call, you sometimes get me directly instead of even going through the front desk.
And that is that's unique to get a hold of the doctor directly.
I get some people say, I wasn't trying to call the doctor. And like, well, I can still do whatever you need.
Well, now, are you able to do some of the labs and things there?
Yeah,
I mean, so they don't have to go outside.
Exactly. We have an agreement with LabCorp, so we draw the blood there, send it to LabCorp. You can get like an A1C for $4, a CBC $2. These are tests that would cost you $200 if you went through your insurance. You're never going to get a bill down the road that you didn't know about. We tell you the price. So you can get a whole panel for $18. So
You've got to be kidding. The whole panel is $18?
Yeah, we get the results by the next day. So
I think you're perking up people's ears as they're listening, because this is so new.
It makes people sick when they realize what they're paying insurance companies. I know companies that pay upwards of $1,500 a month, and that's with deductibles that are $5,000, $10,000, and yet we can do all that for $50 a month for employees. So yeah, we have a lot of companies that can't afford the insurance, but they'll pay the $50. And we have companies that still are now self-funded companies that realize that this is a set cost. We don't send any claims in. So at the end of the year, these insurance companies look at these companies and say, hey, you didn't have any claims, we're going down on your premiums. Or this money goes back into the company because they're self-funded. So yeah, it's definitely a changing network. It really started more out west, Seattle area. A company called Q-Liance does it for Amazon, some Expedia, some big companies. But they even do it for the state's Medicaid system.
Really?
Yeah. Saved the state probably 20%. There's a company, actually a county in North Carolina called Union County. They offered direct primary care to all their employees. 44% voluntarily did this direct primary care. Voluntarily. So it saved the county $1.4 million last year.
Oh my goodness.
Yeah.
That is amazing.
It's big. And they were happier because the service is different.
So is this called direct care? Is that
direct primary care?
Okay. Do you are there other places around that have this kind of thing? I mean, this is the first I've heard of this type of.
Yeah, we're the first in Alabama. We're probably the first in the country that has a gym included with it. There's a few in Georgia, a few in Tennessee. There's 22 states that have already passed direct primary care laws. We're trying to work with our representatives here, Mr. Ledbetter, and get that passed here in the state. But you're going to see a lot more. I've had plenty of doctors come to me because the system, like I said, is broken. They're not enjoying their job because they're having to see more and more patients, and they're not feeling like they're doing as good a job as they could if they got to spend time with the doctors or with the patients and not on the charts, on the patients.
Yeah.
So.
And, now they're having to hire people who can do coding and billing and all those
to go in the room with them to do the billing just to go to the next room faster. Yeah, it's a lot different. We don't carry the computer in the room. We carry, one sheet with the patient's medical records so we can look the patient in the eye and see them. So it's a lot different. But
now, let me ask you this. How did you decide that this was the path you wanted to go down?
Yeah.
Where did you learn about it, and how did you decide this is what I want to do for my practice?
Right. Well, first, I never thought the system made sense to me. Like I said, auto insurance doesn't do this. I always heard patients grumbling. I always heard doctors grumbling, and I thought there's got to be a better way. I looked at just doing straight cash. You come in and pay cash, and you're out the door. But then I realized we really want to focus more on preventive stuff, so I wanted to do more of a monthly membership. I started looking around, found a few companies out in the West that were doing it. The American Academy of Family Physicians is now actually backing this pretty heavily. I think there's more than 10% of doctors actually doing this now in some capacity, either concierge medicine or direct primary care. And there's definitely some concierge type medicine in Alabama, but none that don't do any billing. We don't do any, insurance billing. So I went out west, went to Kansas City, went to a few other Wichita out there, and went to these doctors' offices and said, "Is this for real? Tell me how you did this." And been doing my homework ever since until I came up with a plan that works. We have a lower overhead because we don't have that entire crew trying to do billing, trying to see so many patients. We're all about more quality. So we have a person, Megan, who does basically the pharmacy, the labs, the answering the phone, but I also help with these things. I'll do the vitals, I can draw the blood, I can do the labs, I can answer the phone, So we're very, very lean and efficient.
Well, it sounds like personalization is what I was trying to say. Sometimes you feel like the number, and you go and you sit there for an hour waiting on your appointment that,
Endless, yeah.
Yeah. Well, tell me about medications. How do you help offset the cost? Because prescription costs they're crazy.
It is outrageous.
So how does an individual who is required to have, say, blood pressure medication, or hypertension, how does that patient make that affordable to them?
Right. So the biggest thing is doctors will write the script. They'll go to their pharmacy, and now we electronically send that or fax it Sometimes it never gets there. Sometimes the patient gets there and can't afford the medicine. Sometimes there is errors where it get the wrong medicine. And then we wonder, did the patient actually taking the medicine? Well, now we've brought it in-house. We order the same places that pharmacies get their meds from, and we sell it for wholesale because our money comes from membership. After that, you get wholesale labs, everything else is just an added bonus. So now I can tell that patient knows exactly how much the medicine costs. I know that he's taking his medicine because he comes back there and gets it refilled. If they choose to, they can still go to their own pharmacies, but we get it for wholesale, which is even better than co-pays.
Right.
We have one patient that was spending $80 a month on his blood pressure meds, his heart medicines, his diabetes medicines, $80 a month. Well, now we get that same 6-7 medicines for $11, which pays for him to come to our clinic for $60 a month.
Wow.
So now he's getting unlimited visits, his meds for $11, and I know that he's taking them and can afford them, and he's doing good. So, and now coming off those meds, because we can actually encourage him to lose weight and exercise and do the things he's supposed to do.
I think most people who are watching today, their mouth just fell open because I'm like, I got to close my mouth back. When you said $11 for the $80 that he was paying through the insurance company and then having to come back, and it sounds very revolutionary.
People say it's too good to be true, and I just say, hey, there's no contract. Try it out for a month. If you don't like it, you can always leave. But we add 30 patients a month on average, which is fastest than any other direct primary care is doing in the country. And we probably have 1 or 2 that drop out a month. So we definitely have people that are sticking with us, that understand it, and are seeing the value in it.
Well, and that's the key right there. Go try it for a month. See what you think. Go see Dr. Chad and see what you think about the tell me the name again.
DeKalbMD, Direct Primary Care.
Direct Primary Care,
you can check us out, DeKalbMD.com, Facebook page. Call us. We do free consultations, or just try it out for a month.
That is really unique. Now tell me about the 24-hour gym. Is that something you have a card, or is there a person there, or what?
So it's in the same building as ours. On one side of it, it's an outside entrance, or they can come through the clinic if we're open. But what they'll do is a little key card, just like your gold gyms, little, coupon cards, goes in your keychain. They'll scan in. We can keep up with it. So some businesses actually reimburse the patient or their employees so much a year if they go to the gym.
So many times
So we
a year.
can keep up with it in our system that they're coming in. It's good little cardio area, good little Cybex machines, free weights, TVs, showers. They can get their showers, go to work. Got 2 locker rooms. So it's definitely for the everyday person.
And someone that has crazy work hours would love that access to the gym and be able to come at their convenience.
Yeah, that's what we're about. We don't want you to have any excuses because it's open all the time. It's centrally located in town. We have plenty of parking. There's actually in the works of next month bringing in a personal trainer we're hoping to give a few free visits to, as well as $25 a visit after that to the personal trainer. But she'll actually be there all the time with them to help them out. So
wow. So on average, it's like $60 a month. Is that what you said?
For individuals, $100 for couples, and $10 for kids.
Wow.
So
that's cheaper than a monthly premium.
Yeah, it is definitely affordable once we go to a direct route.
And someone, like you said, let's reiterate that they would want to get a catastrophic policy in case they were hospitalized or something of that nature, that this insurance, because those costs are astronomical hospital stays.
Right.
We're talking about preventive medicine, and if you have a sickness or something you need to come see you about. Yeah,
we can remove moles, we can do laceration repairs, INDs. We can do all those procedures that are included in that, EKGs. But yeah, it's actually in the Affordable Care Act, if it's still around in a few months, that with direct primary care, if you have a wraparound insurance, high deductible, that actually meets the requirements of, and that's what it should be anyways, I think. Like I said, I believe people should have an HSA, say $2,000, $5,000, and then after that have a high deductible where the insurance picks up after you've used your HSA. After that, $5,000 or so, whatever's more comfortable for the company or the patient. Use that HSA on your membership with us if you want to, and you're going to get better bang for your buck, I believe.
Well, I think if you're adding new members each month, it's just going to be something that spreads, because people word of mouth is a great tool
Yeah.
for advertising.
Yeah, and we actually do a $100 referral to our patients, every person they refer. That's just because we believe in it, and they're actually already doing it, so we might as well, say
Well,
thank
I know
you.
a lot of educators might be interested in looking into that because most of educators, which I know, has a certain amount of insurance, and then they pay a surcharge for parents
Right.
and those kinds of things.
Yeah, the state of New Jersey actually is trying to implement for all of their, actually they did implement for all of their state employees, direct primary care, they will pay the $50, or such, I forgot how much it is in New Jersey.
Like for the monthly membership?
Yeah, they'll pay
Okay.
it, the state of New Jersey. So yeah, eventually I think Alabama needs to look in this because, like I said, it would save the Medicaid program, it would save in the state budget. It's just a better way of doing business.
Well, I remember years ago when this is going to date me a lot, okay? So I remember when we had 8 tracks went to cassettes, we thought that'd never happen. When the cassettes went to CDs, we thought that's never going to take off.
Right.
Now everything's electronic. We used to think you had to have the regular TV. Now it's going to internet television.
Right.
So times are changing. Things are coming down the pipe we never thought would
You're right.
be here. And so this is a new way to think about healthcare, going to see a doctor, health insurance, primary health care right here in Fort Payne. So what do you see as the greatest need of what we can do to promote this type of event to someone that maybe is unhappy? I know you said they can come for a free consultation. Anything else you would suggest? Maybe research it on their own?
Yeah, there's plenty of resources, and we put a lot of that on our website and Facebook. But yeah, you might as well just try it out. But I would definitely, either way, if you use us or somebody else, tell your doctor this is what you would want to do. Tell your employer that, hey, can we start looking at more options? I tell a lot of employers, just give them 2 options. It doesn't cost you anymore if you give them 2 options. Give them the traditional plan, then give them the HSA high deductible plan.
Now, HSA stands for
Health spending account.
health spending
Yep.
account.
You're,
Okay.
you're about to hear a lot more of health spending. It's tax-free.
Mm-hmm.
You're going to hear a lot more about that once this new administration gets its feet on the ground and running. Dr. Ben Carson's a huge HSA, the new federal surgeon,
Mm-hmm.
all those guys. Those are all on board because it puts the money back into the patient's hand, and it makes them responsible.
Well, another thing you said was someone already knows up front the cost of their medication before they even start. And
Yeah.
I'm sure there's generic things you could look at.
Yeah.
But cutting those costs and cutting out the middleman is something that would be very consumer savvy. Maybe that's a better word
Yeah.
to use.
Yeah, I agree. I think that's the way it's got to be. The system is, again, broken, but how are we going to get back to it? I think this is one of those ways we get back to it, and I think people actually will like it better when it's said and done because the service is going to be better. Doctors are going to be happier, and a happy doctor is always better to see.
It's kind of like when you go in for a parent-teacher conference. You want the teacher to be in a good mood
Yeah,
when you go see them.
exactly.
So you want your doctor to be happy as well.
Yep.
So tell us the web address, the phone number,
Yeah,
the Facebook page, so we can make sure the people hear that one more time.
Yeah, again, it's decabmd.com. That's our website, and you can actually go there to get started and put all your information in. But I'd encourage you to come at least meet us, see the facility first, free consultation. That way you know what you're getting into. After that, Facebook, it's under DeKalbMD. We're on Twitter, DeKalbMD. But yeah, 256-979-1633, WinMed. Farmers got us that.
Okay.
And they can, talk to our patient care coordinators or me, and we'd be glad to.
And
explain to
also
them.
come and see the gym. For that $60 membership fee, you get to see a doctor, plus you get a
Yeah.
gym that's open
Yeah.
24 hours a day. You go in at your own convenience. I like the idea that you can go before work, shower, and get dressed and be ready to
Yep,
go.
no holidays, no closed.
And hopefully coming down the pike will be a personal trainer. You get so much of a free visit, and then you'd have to pay a little bit after that.
Correct.
And it's kind of like anything else. Some of us go walking and we think we're getting healthy, but that personal trainer can give us some better advice,
Yeah.
better using of
A
our
different
time.
perspective, I agree.
Well, you've been visiting with Dr. Chad Williamson from right here in DeKalb County. He has his own business in Fort Payne, and we're certainly glad you joined us today. I hope you'll join us next time on Mountain Valley Today.